I am Dr. Suman Kirti. I did my MBBS and MD from Maulana Azad Medical College, New Delhi. I am working as Senior Consultant Endocrinologist at Holy Family Hospital, New Delhi. When do we suspect or diagnose nephropathy in a diabetic patient? Now, any diabetic, when we first see him, type 2 patient, should be tested for nephropathy because we don't know how long this patient has been diabetic before diagnosis. Whereas it is different for type 1 diabetes, where we know exactly when the patient started the type 1 diabetes. So, in type 1 diabetic, we do studies for renal function and nephropathy after 5 years of the diagnosis of type 1. Whereas in type 2 diabetes, we do it right at the beginning, the first presentation. And then we can tell what stage of nephropathy the patient might be in. Supposing the patient's creatinine and eGFR, see, creatinine is less than normal, that is stage 1 of nephropathy. That means everyone will be happy, okay, creatinine is less than normal, but it's not a good thing to have that. It means the kidney is already under stress, it's an enlarged kidney, there's hyperfiltration. This would be stage 1. The eGFR is high and the serum creatinine is low. At this stage we can reverse it. You control diabetes, it will reverse to normal. The next stage is of microalbuminuria, which is more than 30 milligrams per day of albumin excretion in the urine. So, this would be stage 1, no, stage 2. Now, at this stage also, if we diagnose it, we can reverse it to normal and the patient can be free of nephropathy. When it goes to beyond 300, between 30 and 300 is microalbumin, more than 300 is macroalbumin. At that stage, though you can prevent further damage to kidney, but total reversal is very difficult from the stage of macroalbumin. And then gradually the patient's glomerular filtration rate falls and the patient goes into renal failure, which would be mild, moderate or severe. Mild would be an eGFR of more than 60, between 60 and 90, and as it falls, this would be age related. If the patient is younger, we expect it to be 90, but if the patient is older, then it would be about 60. So, 45 to 60 is definitely a mild renal failure. 30 to 45 is moderate renal failure, less than 30 is severe renal impairment, and by the time it reaches 5 to 10 ml per minute, patient goes for dialysis.